Greetings and welcome to the latest event in the Geese College of Business Global Challenges in Business webinar series. I'm Amanda Brantner, Senior Associate Director in Online Programs here at Geese College of Business at the University of Illinois, and I look forward to spending the next hour with you. Our faculty experts at Geese have developed this series of webinars to address the business implications of coronavirus and enable you to be better prepared for the challenges and opportunities it presents. We hope that today you'll gain some knowledge and strategies to not only weather this storm, but succeed through it. Before we get started with social media analytics and the COVID-19 infodemic by Professor Joseph Yun, I want to cover a few housekeeping items related to the Q&A portion of today's session. Please submit all of your questions via the Zoom Q&A feature. Your questions will be submitted publicly for the whole audience to see. In order to develop consensus around questions, please use upvoting. The upvote thumb is located next to the question in the Q&A window. You can only upvote once per question, but you can reverse your vote. We will bring the top questions to Professor Yun following the presentation. Any general housekeeping questions will be answered in text by the Geese team working in the background. Questions submitted to Professor Yun via chat will not be taken. It's my privilege to introduce today's presenter, Joseph Yun. Joseph is part of the accounting faculty here at Geese, which are ranked #1 in the nation in the BYU Faculty Research Rankings. He is a leading expert in social media, data, and technology, and he has been directly applying his expertise to this current pandemic. He leads a team of social media analysts to support the Pan American Health Organization's efforts managing social media strategies for COVID-19 in the Americas. He also works with the World Health Organization to combat the COVID-19 infodemic of misinformation. When it comes to teaching us about social media analytics and how it can fight misinformation during COVID-19, there is no more qualified person. Please join me in welcoming Professor Joseph Yun.
Thank you so much, Amanda. I will pull up my slides, and it's a pleasure to be here and to share this time with you all. I'm really privileged to be able to be presenting this material to you. And so just as Amanda had mentioned, I'll be going over a presentation entitled Social Media Analytics and the COVID-19 Infodemic. And as I begin, this is kind of like the Oscars where you feel like you're going to forget who to give credit to. And we clearly don't have time to go through all of this, but I did want to acknowledge just some organizations that have been pivotal to the creation of this work. The Granger College of Engineering Center for Health Informatics, who is on our campus, the people that have been interfacing with the WHO for quite some time now. Also our technology services, CIO's office and NCSA, that really has been the team that has been supporting me in this work, the technical team. Of course, the World Health Organization, and then the Pan American Health Organization, which is a sub-region organization of the WHO. It's been unbelievably a privilege to work with them. And then of course, our very own Geese College of Business. I mean, I could go on to talk about how awesome this college is. I just joined this year, but I could wholeheartedly say, I think, if not the most innovative, one of the most innovative business colleges in the world. And it's a privilege to have the support of my college in this work. So, what I've realized is I am trying to take 1 or 2 whole courses and position it all into a 35-40 minute presentation, and I realize that's impossible. So I'm going to try to do my best to not speak really fast, but I'm going to try to cover 3 major topics here as one whole presentation. First, I'd like to give a brief primer. Now, this is a whole course that I have taught, but just one brief primer session on what social media analytics is. Then I'll go into what is the World Health Organization organizing with regards to social media analytics and the COVID-19 infodemic. And then thirdly and lastly, I will discuss how we here at the University of Illinois are participating in the COVID-19 infodemic efforts. And so I do want to say that the first portion is probably longer than the rest of the second and third. So don't feel like I'm going to go 2 hours if the first portion is going a little bit longer. So first, what is social media analytics? This is a very technical definition, and I'm not going to read it, but I could just simply say this. Social media analytics is taking social data. You could consider that as social media, but you could imagine actually any data that we create, even our devices create, let's say our location data from our phones, it's all social data. And the enterprise of social media analytics is taking that data and analyzing it in some computational way to understand more about people and more about society. And so that is really in a nutshell what social media analytics is. Now there's various paradigms and frameworks as to how people go about conducting social media analytics. This is one that I use in my courses by Fawn and Gordon, which is the CUP process. And it's simply capture. You have to first capture the data that you're trying to analyze. And then secondly, understand. And I like that word understand better than analyze, because analyze is something that's inherently computational. Understand is taking that computational analysis and from a human perspective, basically bringing in our culture, bringing in the various understanding that we have that computers cannot understand at this point, and so on and so forth. The human element of looking at analytics from computer. And then of course, thirdly, we need to present those results. And this is something that I'll talk about in this presentation that is really neglected, I think, when it comes to data science in general. And so we'll go over that and all three of these processes. So first, we need to capture data. Now, there's various ways to capture social data. One of the probably main ways is to use what's called a public API. API stands for Application Programming Interface, but what I usually say in my courses is you could think of it like the spigot if you own a home, or if you have any sort of building that you live in where you can connect a hose to pull water out of that building, that there is that interface, that spigot that you have to connect to, and you have to have the right type of connection on your hose to connect to that outflow of water. And you can consider a public API as a data spigot where data is flowing out instead of water. And there are certain rules as to how you have to finesse or create your hose to be able to connect to that data spigot. And so various social media platforms like Twitter actually give you the instructions of here's how you connect your computer via this data spigot so that you can pull Twitter data into your computer to analyze. You could also go and purchase that data from various companies of which their business model is to go and contact places like Twitter and Facebook and so on and so forth. And they purchase data, and they'll give you certain access to that data as you go to them for the purchasing of that data. And then the third kind of major way to capture data is public or private scraping or logging of data. Now, I wanted to mention this because this is a lot of how social data is collected. But personally, with regards to my research and my work, I've always stayed away from this because a lot of times, doing these kind of things are against terms of service. We try not to do things that are illegal, unethical, these kind of things. But I did want to point that out, that this is a major way that social data is collected. For example, I bring up WhatsApp. There's definitely applications out there that'll create a bot that will sit in a room, pretend they're kind of like a human, and then really at the end of the day be scraping the data in that chat. So these are kind of three major ways that social data is captured. And again, this could be a whole 1 or 2 course sessions. But once we now have that data, so we've connected, let's say, to the API, to the spigot, we've pulled all of this data in, now we need to go through the process of understanding. Now, understanding is really hard when it comes not just to social media analytics, but to data science in general, because data science for human understanding is still very messy. What do I mean by that? I mean that there's kind of 2 competing forces. One is what you want, and the other is what is possible. So let's use this as an example. This is from a recent paper that I published with regards to just understanding topics from a computational standpoint, right? So what I want is, what are the topics of conversation around COVID-19 coming from, let's say, Twitter, okay? But then that's what I want, but what is computationally possible? And those 2 things are not necessarily fitting. They're not necessarily congruent. What do I mean by that? Well, I'll illustrate this kind of tension or this issue or the dynamic in this example of I took Twitter data connected to their spigot. I used the search term COVID-19 to pull all the tweets or a sample of the tweets that are talking about COVID-19. And then I applied at least what I'm going to show you in this presentation, 4 different methods to give understanding or give evidence to what are people talking about. Seems like such a reasonable and simple thing to analyze, but not that straightforward. So here is one process it's a very basic or foundational process, pre-processing tokenization process. But what you're seeing here is basically you take all of those tweets that we collected on COVID-19, you break it up into individual words, and you don't even think about, like, for example, if United States is 2 words, you naturally would, as a human, would say that those 2 need to stay together. But in this process, you just split them up. And then you do something called stemming, which is if you have a word like run, runs, running, you realize it's all really at the same stem, the same word. And so you break it down. And so this is a visualization of, if you stem the words and treat them as separate, what are the most frequent words in my data set that are talking about COVID, so that we can understand what are people talking about. And you look at these words, and yeah, COVID, people, state, health, hospital, fight, die, region, report, support, time. I mean, you go through this, but you still have to take this kind of human step and say, what is being talked about here? Because it's not necessarily straightforward. Then you have another way you can look at this via a word tree method, where you're literally just kind of interactively, this is an interactive method, but because live demos usually are not good for presentations, this is just a screenshot. But you could click on any of these words and this word tree will kind of expand, and you can kind of qualitatively look around and say, okay, what are people talking about? But again, not that straightforward, but a different method. Here's a method that's very popular. It's called LDA topic modeling. And this is a method that I've actually had some, not disdain towards, but I've heard a lot of people say, well, all you have to do is use LDA topic modeling, and then you'll understand what, the topics of what people are talking about. But that's not actually how this method works. As you can see right here, first of all, how this, and I'm not going to go too much into it, but you actually have to, when you're conducting this method, say, how many topics do I think are being talked about here? And you can mathematically get at that number. So I'll say 5. And then really what this method does is it just tries to cluster words that are similar to one another into these 5 categories. And so if we zero in on this first cluster, we see these words: COVID, retweet, new, case, state, etc. This isn't a method that tells you what topics are being talked about. This is a method that clusters words together, in which you have to try to then derive what is the topic that is being talked about from these clustered words. And you see, as I'm explaining each one of these methods, how messy this is. This is not, data science is not magic. It involves an understanding of what the methodology is that is being used, and then translating that into what you're trying to understand. The last one I'll go over is, a newer method comes out of a lab right here at University of Illinois, Jaiwei Han's lab, and his previous PhD student, Jingbo Shang. And this is really innovative. This is actually an attempt to get a computer to figure out when phrases or when words are supposed to stick together as phrases. I mean, think about how hard that is. How does a computer know that United and States is supposed to be together? How does a computer know that Geese College of Business is supposed to be together, especially since the naming of the college was so recent, right? And long story short, I mean, this is really involved mathematically, but one of the innovations that they brought into this was, why don't we use Wikipedia as a verification body where, if there's a Wikipedia article for Geese College of Business, then that must be a quality phrase. And so we'll use that as part of our algorithm to figure out what are phrases, right? And so we see here a list of phrases that are being talked about when it comes to COVID-19. This is the same underlying data as the 3 previous methods I just showed. But as you can see, you see very different results. And you have to really understand, okay, the different ways that I analyze this data computationally is thus going to transform into a different way that I try to understand this information. So with regards to this understand phase, you know, another issue I think with regards to trying to conduct this kind of data science is that all of these previous methods require some knowledge of coding. So, you know, I have a computer science background initially. And so if you have Python, R nowadays, these kind of coding languages, you know, you can get by and you know, to really do a good job at these things. But as I was going through my graduate studies, I started realizing as I was working with, you know, so many brilliant people that were not necessarily from computational backgrounds, that there needed to be another solution, or at least an additional solution to provide an alternative that was more accessible when it comes to data science and specifically social media analytics. And what I mean by accessible in this case is, you know, can we build a system or a program or a tool or a platform where people don't need to have a coding background, at least primarily, a system that was low cost. You know, social media analytics is a pretty big enterprise and it's expensive. But for the sake of research, you know, can we create a system that's low cost and really in this case for academics free, as well as cloud hosted, because data science many times needs, you know, much more compute that's on your laptop. And so can we create a solution where people can run these things in the cloud on larger computers? And so it all kind of culminated in this napkin drawing, you know, as part of this incubator for the National Science Foundation. And, you know, one of the first things they told me to do was to create a napkin drawing, a visionary drawing of what am I trying to create? And so basically what I landed upon was I want to create the most advanced open social media analytics platform for research in the world. And that word open is really important because there are many advanced social media analytics platforms for research, but they're very expensive. And so I wanted to do something where it was something in between a microscope and a telescope, where researchers could connect to social media data coming from the world and analyze it in a way that's transparent, it's open. And so where we got to, you know, this started first as just me, and then a whole team kind of surrounded me, and really at the end of the day made this what it is. We ended up with the social media Microscope, which is a open analytics environment to analyze social media data for research. And I wanted to give you a little preview of one of the tools that is in the social media Microscope. So what I'm going to show you next is a video with no sound. I'll just kind of voice over it because again, a live demo might be pretty dangerous in a presentation like this. But I do want to you know, make it clear to you all that this this platform right now is actually available for you to use, especially if you're doing work as a researcher or nonprofit or these kind of things. Commercially, if you're using this, you know, it'd be nice to discuss with the university. But here is a tool, one of the tools in the social media Microscope called SMILE, which is the social media intelligence and learning environment. And what you'll see through this is we're trying to make it easier for people to conduct data science on social media data, so thus to conduct social media analytics. So if you log into the social media Microscope and you fire up SMILE, you'll start to see these kind of, you know, complex tasks like automated phrase mining or network analysis or conversational personality detection. You know, all these things are programmed into this tool. And you can just get data, start first with the capture process. And so, you know, one of the things that's hard with regards to capturing data is connecting to that Twitter spigot. It takes some coding, it takes some knowledge. It's not as straightforward as you would think, but we tried to make it super simple here by just push button interface, seeing screens that you've already screened in Twitter or seen in Twitter. And then once you do that, you can immediately search with like a Google-like search bar. And here you search for COVID-19, autocorrect, change it to cover-19, but fix that back. We click on search, and we immediately see a preview of tweets that are regarding COVID-19 here. And so now that we have this data set, and these are thousands of tweets that we pulled in seconds. Now that we have this data set, let's conduct a couple of the methods that I showed in the previous slides. So you select COVID-19, you see another preview to make sure you're looking at the right data. And then you select how you want to go about it. You want to stem, and then you want to use this NLTK speech tagger. And we give you the links to all the academic articles in this tool because, again, it's about being open. We're telling you, here's exactly how this analysis is being done. Because you need to, as I showed previously, you really need to understand how these analyses work so that you can then understand how, as a human, to interpret these things and to make generalizations or to take insights out of these analytics. So that's just a kind of a view of the social media microscope, and Smile is one tool in the social media microscope. Now, just to clarify, the social media microscope is kind of like the app store on your phone. I mean, it is an app, but it's not an app that you go to use. It's an app that you go to search for other apps to then use. And so the social media microscope is the app store. Smile is just one app that is in the social media microscope that can use. And this is important because I'll talk a little bit later about an app that we've been creating for the WHO. So finally, with regards to understanding, I mentioned there's this tension between what you want versus what is possible. And I told you what I wanted were what are the topics of conversation around COVID-19. But then as I've been in this field for a little bit of time, and as I've done consulting, and so academic work and industry work, I've realized as a data scientist, as somebody with a computer science background, I started asking myself, wait a second, is it really about what I want or is it about what they want? Now this is huge because data practitioners like myself and data academics sometimes focus, and I'm talking about myself, more on what is cutting edge or what is interesting or what is just mathematically cool. Like I want to show you a dashboard that shows you the most cutting edge, analytics technique, but then at the end of the day, it's not that practically helpful for the person that is asking the question. And in this case, the people that are asking the question are the World Health Organization and the Pan American Health Organization. And so I started realizing over time that it's not necessarily always about what is computationally fancy, but it's much more about what is practically like immediately helpful. And so that's, I think, one thing that's key in this whole present step is that I'm realizing that the present step is not at the end. It's starting from the beginning to the end. And this is a kind of a preview of my data storytelling course that I'll be teaching this fall, is that before you ever even collect or analyze data, you have to have a conversation or many conversations or a running conversation with the individuals that you're eventually going to present to, because you have to understand their needs and what they're looking for. And this is, so important, especially in the business context. And so that's something that we really tried to do. And so how we tried to do that was we started from the beginning with the World Health Organization. And so what is the World Health Organization organizing with regards to social media analytics and the COVID-19 infodemic? Now I want to define infodemic. And so I just took this great quote. I'll just read it. We're not just fighting an epidemic, we're fighting an infodemic, said Tedros Adhanom Ghebreyesus, Director General of the World Health Organization in mid-February. And he was referring to fake news that spreads faster and more easily than this virus. The WHO is realizing that there's, of course, the pandemic from a health perspective that is occurring, but all of this information about the pandemic on the internet is also occurring, the spread of information. There's good information and then there's misinformation. And basically this is maybe as or close to as important to deal with as the actual health concern, the virus itself. And so the WHO on very short notice put together this really, if I can say, unbelievable online conference that happened in April, early April, 7th and 8th, obviously out of Switzerland. And, to be honest, as I was attending this online conference, it was kind of like the Avengers of data science and social science. It was an unbelievable time. And I can show you right here that all the regions of the world were very well represented, a lot of Europe and Central Asia, and then the sectors that were participating, academia, public health, civil society, private students. It was just a wonderful time that we had. And our team got to present as part of this online conference. And basically what we were presenting on was the fact that we were beginning to work with a sub-region of the WHO, which is the Pan-American region, to help them directly with regards to this infodemic. So thirdly, I'd like to go into how, let me check my time. Okay, we're doing very well here. How are we participating in the COVID-19 infodemic effort? So just to take a kind of a high level step back, what is the Pan American Health Organization? It is a sub-region of the WHO, and as you can see in this map, there are various sub-regions that the WHO kind of splits up to cover the whole Earth. And if you are in the United States like myself, then you are part of the Pan American Health Organization, the region of the Americas, and in this figure, the kind of pinkish salmon color. And so my team has been working directly with the technology leaders at the Pan American Health Organization, specifically regarding COVID-19 and the infodemic that is occurring right now. Now, let's take a step back and think about what I just previously discussed with regards to the present stage. When we started first talking to the PAHO leadership, what we started realizing was much of the Americas is not English speaking. In fact, a large portion, I don't know if a majority, maybe it is a majority, are Spanish speaking. I don't personally speak Spanish. I speak Korean, I speak English, but definitely not Spanish. As well as I realized that when you look at data science tools, most of it is based in English. It's not necessarily based in other languages. And so the data scientist in me might say, okay, well, I only really know English and or Korean, and most of the tools are English, so let's just go with English. But that would not be right in thinking about who we are actually trying to serve, who we're actually trying to present to. And so that was one of our biggest things, was we need to focus especially on Spanish, not just on English, as well as other languages that are represented in the PAHO regions. The second thing, or this is the third bullet point here, we realized social data patterns for regions are different. There are just obviously different cultures that are represented in the Americas. There's just different ways that people talk and how information spreads. And so it wasn't going to be just kind of an easy one-stop shop dashboard for everybody in the Pan American region. We had to be much more customized. And then of course, I've mentioned this before, and this is really, maybe others are not like this, but I'm speaking about really myself, is that sometimes we like to do what is computationally fancy versus what is practically helpful. And, even this just step of, let's do this in Spanish, at least partially, that was so huge for this analysis. But something where you think, well, that's not that computationally fancy, right? It's not some kind of advanced mathematics, but really that is what is helpful, and dare I say right now important, is meeting the individuals as to where they're at. So the way that we first started to address this was through a series of printed reports. It takes some time to build an interactive computational dashboard. And so we started using tools that we have access to in our teams here, the U of I. We gave them a trending map. If you look at the top left section here, a volume of how Twitter conversation is trending. And just as a note, it's not that we're only looking at Twitter, but Twitter, because of its volume, it just kind of overpowers most social media conversation that we can track. And then in the left bottom quadrant, you see the geographies of where that conversation surrounding COVID is coming from. And then on the right side, we started looking at who are the influencers in the conversation about COVID that maybe PAHO could reach out to, because PAHO definitely has a relationship with all the ministries of health for every single PAHO country. And so let's think about who are the people that we can reach out to and say, hey, can you help us with these infodemic efforts? But then in that bottom right-hand quadrant, you see there, we started looking at, okay, let's exclude US for now, just because it was taking up so much of the conversation. And let's now look at Spanish, Portuguese, and French. And if we look at those languages, who are the influencers? And you can see that there are different people as compared to the US/English based influencers above them. And this is, again, kind of, understanding, our population, understanding who we are trying to serve here, and then appropriating our data science accordingly. Then after a little while, after these reports were sent, the problem with kind of static reports is that they're static reports. And so what we wanted to do was to build a tool that would be more interactive and more real-time for PAHO. Now, this, again, is like another tool in the App Store of the Social Media Microscope, except if you go to the Social Media Microscope today, you will not see this tool because this is just private for PAHO leadership. But we built it within the Social Media Microscope as a private dashboard. And so we started asking them, what are some things that you would want from us as we build out this dashboard? And so one of the first things they said was, they said, we are contacting the ministries of health of every single country in PAHO. And what we are asking them to do is to use certain hashtags when they communicate about COVID so that we could track the conversation, so on and so forth. And so they came back to us and said, hey, can you let us know what hashtags are most prevalently being used by each Ministry of Health from each one of our countries? And so maybe not data science fancy, computationally advanced, but incredibly helpful for the PAHO leadership. And actually, it is somewhat advanced to present this in a dashboard like this. And so what you see here is each one of the countries. Now, these are not all the PAHO countries, but these are all the PAHO countries that have an active Twitter account from their Ministry of Health. And so if you look at Dominican Republic is highlighted right here. And again, this is a live real-time dashboard, but I'm just showing you screenshots. You'll actually see hashtags that they're using with regards to their Ministry of Health Twitter account. And so this was something where when we unveiled this, the PAHO leadership were incredibly excited about this because this allowed them to then work hand in hand with the Ministry of Health and say, hey, it seems like your hashtags are actually more focused on these things rather than focused on these other things. And so could you potentially do this next, right? It's a strategic tool. And so this was one of the first things that we put into their dashboard. Second piece of this dashboard that we've worked on was taking conversation around COVID, and this is not just Twitter. This is across many different social media platforms. So conversation on COVID-19, COVID_19 or coronavirus, and to understand what are people talking about, but in Spanish. And so you see right here, again, I don't speak or read Spanish, so I can't say right now what all these mean. But when the PAHO leadership were looking at this, they were saying, this is wonderful. This is incredibly helpful for us to understand what are some things that people are talking about from a Spanish standpoint surrounding these terms. We now see a word cloud. I'm sure many of you are familiar of word clouds, but the difference here is it's in Spanish and understanding what people are talking about when it comes to COVID-19 in the Spanish language. They also wanted to see a breakdown of, okay, if we take Twitter out, so if we kept Twitter in, you would just see a whole pie of Twitter. But taking Twitter out, what are some other platforms that people are discussing COVID-19 on? And so you see platforms like Reddit, Tumblr, you see a lot of blogs. The comment section is actually comments from sites like YouTube, so on and so forth. And so, again, we're kind of giving them a command center. That's not necessarily, you could kind of say that there are, or not you can say, there are definitely COVID-19 social media analytics dashboards on the web that you could find. But the difference with this one is that most of those generic ones on the web, which I'm not saying are negative, I'm just saying are not immediately helpful for PAHO leadership for various reasons that I've outlined. And this is something where it's just been a great partnership. We've both been so thankful and happy to work together because we do really believe this is making a dent in our efforts with regards to addressing COVID and specifically the infodemic side of things. Just kind of a roadmap moving forward. We're going to start looking at Google Trends, so searches in English and Spanish. of what people are searching when it comes to COVID. And obviously that's changing over time. We're also going to do a much more robust analysis of influencers. And this is where, organizations like PAHO and their mother organization, WHO, really do have the ability to contact some major influencers around the world, whether it be celebrities or whatnot, and to say, hey, can you promote what we're doing here, so that we can really make sure that misinformation is not necessarily what's being promoted, but really verified factual information. We're going to go into emotion analyses. Now, I could do a whole, if I sat down with you, I could tell you how something like as simple as what you've heard of sentiment analysis is actually very, very messy. And it's just all about how it's derived. But we're going to give our shot at emotion analyses that's catered towards, again, this conversation and the PAHO leadership. And then discussion around trending topics. Right now, I believe in the PAHO regions, there's a lot of discussion on masks and ventilators, or I guess masks is a little bit more prevalent right now than ventilators. And so trying to understand the conversation surrounding various topics that change as the trend changes. So again, I don't know if I spoke incredibly fast, but what I wanted to cover through this at least one presentation was to just give you a little primer on social media analytics, but specifically to mention it's a bit messy, but I think the most important thing is trying to understand, what are the people that you're working with trying to understand, and through that, then building your whole methodology around that issue and that problem. And so thank you so much. Amanda, I'll hand it back to you if there are any questions.
Yeah, absolutely. Thank you, Joseph. Thank you for sharing the insights about the work that you're doing with PAHO and the World Health Organization, and just the tools that you're using to answer the questions that those organizations have in this very unique and interesting time. There are a number of questions from the audience. Before I jump in, just want to encourage those who are here to open the Q&A window, to upvote the questions that are most important to you as a participant, so that we can make sure we address those, and also add your questions to the Q&A. So to get started, Joseph, so a couple of questions here about maybe the tool a bit more, the open platform that you talked about, Smile, and how it works. So I want to jump into a few of those. One of our learners asked, is Twitter the only source that we can use to pull data for Smile? I think you talked about this a bit, showing some of the other tools that we use, but they asked specifically about can someone specify the websites, or what they refer to as walled gardens like Facebook, et cetera, to be the data sources?
Yes, that's a great question. So right now in Smile, you can pull from Twitter's API, you can pull from Reddit directly. You can also bring in your own data. So if you have any proprietary data yourself, and we don't store that data on our side, so it's private to you, you can bring in, if you have Facebook data, you can bring in Facebook data, although when your session is closed, that data is gone. So just be aware, and that it really protects you and us. We also have a connection to a data aggregator called Crimson Hexagon, but that's only if you have a signed contract with them. And so you can use your API to connect to, or your credentials to connect to Smile. But yeah, so officially, if you're just talking about public APIs, it'd be Twitter and Reddit. But you can bring in your own data, and we've got an upload function to do that. And so any data works as long as it's in a tabular format.
Thank you. A number of learners have expressed interest in that Smile database and the service that it provides. I know you talked briefly about it in the presentation, but could you talk a little bit more about who that's accessible to, and how different audiences might use it or apply it for their use?
Yeah, so I guess I don't want to go too much in my inspirational speech here, or I don't know if inspirational is the right word, but this really has been a labor of love, the social media microscope. It was actually not my dissertation for my PhD, but it was something that I just felt so strongly about, that people didn't have access to a resource like this. And most of these kind of platforms are tens of thousands, if not hundreds of thousands of dollars to use. And so I would throw it back to you saying, right now, the platform is totally free. It's all open source. So if you want the code, you can have the code. run it on your local machine if you have a really, really powerful machine. But because it's free, we're always looking for people that would fund the research and continue to help it grow and whatnot. But it's an open source project, or if you're a developer and you want to contribute to the code, we would really love that. But if you're somebody, and I've always really thought about somebody that just wants to learn, no matter what age you're at, and wants to get into data science. I have a 6-year-old daughter, well, a 4-year-old too, but 6-year-old, I think she's at the point where I'm like, I want to start teaching her data science, and I think this is a really fun way for her to learn. As well as I've also thought about, people that own small businesses. You're not going to be able to pay $100,000 for some sort of social media analytics tool, but you can use this tool for free. It might not have all the bells and whistles, but hopefully it can help you. So really, it's kind of an open invitation, but I can't guarantee that it won't go down someday if there's no funding. But but I'm going to try my best.
Thank you. Next question, still kind of in the software and tools space. A learner asked about using software such as SPSS rather than R or Python. And just wonder if you can comment on that, especially given the number of individuals who are less comfortable with R and Python, and maybe even comment where learners can gain knowledge around those tools if it's something they're interested in.
Sure. So, interesting, like what SPSS really is it's kind of a more graphical interface to conduct statistics so that you don't have to write out extensive code. So it's kind of similar to the Microscope. It's kind of similar to Smile. With that said, I will say that there are definitely things that you can't do with Smile that you would be able to do if you knew how to code in R or Python. And I would say the exact same thing with regards to SPSS. I would probably say R is more of a language for statistics. And so there's that balance, right? Is that SPSS that are excellent in just being able to quickly analyze things and do things if it's very traditional in the way that you're doing the statistics. But if you're trying to do something that's very non-traditional, there's not that many people that have done it before that way, then you're going to have to fire up RStudio and do it in R. And either one of these resources, there's numerous platforms that you can learn from to train up on those. I mean, I don't want to to advertise too much for training platforms, but there's so many data science platforms out there that can train for that, as well as I believe even content here at the University of Illinois. So.
Yeah, thank you, Joseph. Absolutely, we've got some great courses in R and Python, and perhaps can share those with some of the members of today's audience if they're interested. All right, switching gears a little bit. A couple of questions here about the work that you've done and any outcomes that you're seeing or results of how social media is impacting the control of the spread of COVID-19. If any of that with your work is something that you can share insights about or can provide a bit of information on.
Sure. I guess it's not necessarily, I can say, work that I'm immediately doing, but there's quite a bit of research that's coming out that pretty conclusively shows that conversations and advertising and all these various things on social is dramatically affecting what people behaviorally do. And so I think we all know that there's certain misinformation that's on social with regards to COVID that is causing serious health issues apart from COVID in people's lives. And for me, it's really interesting, or maybe concerning is the right word, from a technical standpoint. And so part of what I'm doing is my actual background is computational advertising, interestingly, and I'm a firm believer in marketing and advertising. I just believe that we really need to stand behind what we're marketing and advertising. And so one of the projects that I've become very passionate about from my own research has been advertising science and advertising, what is even happening with regards to things at the university and research. And so I think part of how we can, or part of where I'm seeing potential inroads with regards to COVID-19 moving forward, and I'm sure other viruses that will come in the future, is that we really need to do a better job in promoting factual information. And I think it's got to include computational advertising and personalization and all of these things that we really haven't in the past thought about when it comes to science. And so that's something that I'm incredibly passionate about and would love to do further research in.
Thanks, Joseph. I think that brings in a next question, or statement, I guess, which isn't something I think you need to respond to, but just to bring it to you, is this idea of like unverified or not authentic information, in contrast to scientific advertising and the types of things you were talking about. So thanks for addressing that and kind of sharing your perspective.
If I could actually mention one thing with regards to that comment. So
Please.
I fundamentally believe all of this work that people are doing to like label fake news as like fake news or whatnot, like I think that's incredibly important. I would just say with what I explained, it's very difficult to do data science wise. And I think it's going to be almost impossible real time to get that right, you know, majority of the time as things change, right? Because there's limitations computationally, but the research needs to be done and that needs to move forward. But I would also say that I think where we're missing it is on the side of, even though you might label things as misinformation, what about the fact that there's just not enough correct information that is flowing to us, right? And so we need kind of this like major wave of factual information that's coming at us that could compete with the misinformation. And so I think that's again, I clearly am passionate about this, but I think that's part of what we need.
Yeah, well, we really appreciate your passion and glad you bring that to the discussion today. Thank you. In that same vein, a question comes up about the effect of shelter-in-place announcements on social media and activities and topics in that vein, right? More around behavior, ways we should be changing our behavior in this pandemic. I assume that's similar to your comments around kind of scientific advertising, but anything specific to share there?
Yeah, I mean, I'm going to go on a limb and kind of mention how, one of the realities, but also the uncomfortabilities of the world that we live in is that we put all this stuff out on social, especially public social, but then we get really creeped out if anybody kind of is watching it and using it for some sort of like, procedural or public intervention, right? Because like, why are you watching me? But the reality is we all know, but this is really public, right? And so, there's a lot of research currently being done where, we all have to try to understand as a society, if our public data is out there and there's all this social stuff about shelter at home, there's things where people are posting that clearly are not shelter at home or whatever, wherever you sit on the side of the spectrum. It's a really interesting question as to, like, is it fair game for us to analyze that and to use that, right? Or is it not? What is ethical? What is not ethical? And that's, I sound like I research everything, but that is actually another stream of research that I'm really trying to focus on is, how do we move forward as a society, whatever we may believe, wherever we may stand, but the reality is social data. And, how do we move forward as a society to address the fact that some of this stuff is, people are going to analyze and we have to understand how to work with that.
Thank you. All right, I'm going to switch gears a little bit, a couple more technical questions. A couple of learners have upvoted the question around emotional analysis and sentiment analysis and how those two things are different from each other.
Sure. So that's a whole subset of psychology, social psychology. So I would say just broadly, sentiment analysis is what is usually akin to what's called attitude in psychological research, which is simply, how much do you like something or dislike something? How much favor do you have towards something or disfavor? But there's certain types of constructs called like mood or emotion. Mood might be something that's a little bit longer, whereas like anger could be just a momentary anger, but saying that I'm in a really negative mood today is much more, kind of, it could be anger, it could be sadness, but it could be a longer time period. And so I'm just trying to kind of bring out all the nuances here of when we talk about emotions, sentiment is just one little piece or attitude is one little piece. And so when I say emotional analyses, Just kind of bringing up the fact that we as human beings are very complex when it comes to the various layers of how we feel, right? And so that's, and then if you could think about it that way, think about then how hard it is to detect that computationally. It's not that straightforward. And I'm not trying to make it sound like it's impossible, but I'm just trying to give a piece of reality that it's not like magic, you know, it's not that easy. So.
Absolutely, thank you. All right, our top question in the Q&A right now is around the inefficiencies in most data available. So it says, since there are several inefficiencies in most data available, what would you recommend for a business in order to acquire rich and efficient data that will help the business grow?
Yeah, you know, that's a really good question. I think if I knew the answer to that, I'd be very, very wealthy. But I will say this: this is aligned with what I believe in. There is a concept nowadays called zero-party data, and the best way I can kind of illustrate this is, you know, if you go to a site that sells customized shampoo, and you go to that site, and then it gives you a quiz and says, like, is your hair oily or dry? Is your scalp itchy or not itchy, right? You kind of know what's happening here, right? You're basically giving your data, you're giving your answers to this company because you're expecting them to recommend a customized shampoo product to you. That's called zero-party data, where I'm effectively giving you permission to take my data and then use that data to then market back to me. And it's a mutually beneficial transaction. And so I would really encourage companies to use that tactic as one means to gather people's data, you know, rather than a lot of this kind of like, you're just taking people's data without them knowing. And, you know, it's just like, it's borderline, you know, it's just tough to deal with, right? And so this whole concept of like, ask people for their data, but give them an incentive to give you that data because they know that what they're getting in return is worth you giving them giving you the data. And so that's kind of what I would recommend.
Thanks, that's really helpful. So maybe going back to the basics a little bit, obviously your expertise and experience here is really broad and really deep. But for many individuals, right, while they might use social media, they might have dabbled in analytics in social media, most don't know exactly where to start. So could you maybe just give a bit of background on the best place to start and enable people to begin thinking about social media analytics and how it can impact, you know, their professional lives, or they might be able to apply it in other ways?
Yeah, my favorite thing to do, and this might not be best for everybody, but I really like a lot of these blogs that are out there in blogging platforms. And I'll just throw out I guess I will throw out an advertisement in a sense for medium.com. It's kind of like, you know, small, medium, large. Medium.com is a platform. It's not just data science, but some of the best data scientists in the world blog on there. But one of the things that Medium forces you to do is to reduce what you're trying to say into like a 2 to 3 minute like blog post. So you'll actually get, you know, like I've written some articles, but you know, you get, you know, whoever, the creator of some, you know, crazy data science thing, but then they condense it down to like this 2-minute read. And then of course, here's a link to more information. I would really encourage people to get started that way with data science and just start reading these blogs. And then if you have more of an interest, then definitely take some form of training program to get more into it, because I think it's most helpful to have somebody to kind of bounce ideas off of, ask questions to. But those blogs, I think, are a great way to get an intro to the field.
Thank you. Jumping back in specifically to the work that you've done with PAHO and the World Health Organization, could you talk about any of the outcomes that, or the actions that the organizations have taken based on the insights that you've drawn?
Yeah, so one thing that we're seeing is that PAHO has been actively going back to the WHO at large and have been discussing our results. And then basically, from what I know, the WHO has been changing some of their strategy around this whole infodemic based on the data that we're showing from our side. And so I would say that maybe practical results that you can see. The WHO is putting out a lot of communication on their website as to here are some tips when it comes to this infodemic and whatnot that all the regions are supposed to be reading. We've been actively influencing that communication that's coming out of the WHO.
Great. Well, thank you, Joseph. This has been really wonderful. Lots of great questions here that maybe dive in a little deeper. We'll share those with Joseph in follow-up to today's webinar. It might come back with some answers to those outside of this Q&A. Joseph, any closing comments or things that we didn't get to, or questions that you want to make sure, or comments you might want to make sure to make before we wrap things up today?
I think I just, again, want to say thank you to everybody that listened or will actually see this recording maybe, as well as I do want to throw this out there that, we all need to, band together with regards to the situation around the world. And, maybe some of us are doing the data science thing, but even attending the seminar and joining together like this is so important. So, and I want to, of course, thank Amanda and the whole Geese College of Business for this platform.
Well, Joseph, we really appreciate your time today and the investment that you're making, the way you're putting your research to work here. So thank you so much for all of your great insights. Thank you to all of our participants today for attending this webinar and bringing some great questions to the table. We hope you gained valuable knowledge, and we hope you'll join us for our next webinar, which is on Tuesday, June 2nd at 1 p.m. Central Time. Professor Fei Du will present Good Faith and Forward Looking. How do CEOs and CFOs talk about the impact of the coronavirus shutdown on corporate profits? We look forward to seeing you then, and thank you for joining today. Have a great afternoon.